Welcome back, everyone. As we've been telling you all morning long, Eagles fans will be welcomed back into Lincoln Financial Field this Sunday. It comes after the city loosened COVID-19 restrictions on gatherings. Joining us now to talk about the decision is Health Commissioner Dr. Thomas Farley. Good morning, Dr. Farley.
Good morning.
So first of all, talk to us about what was considered when making this decision to loosen some of the restrictions.
Well, the governor had restrictions before on indoor and outdoor gatherings, and he loosened the restrictions. And so we had to decide whether we would apply those rules here in Philly. And indoors, we have much tighter limits. We decided we couldn't allow what the governor allowed. But outdoors, we feel the risk is much less. And so we did allow people to have 20% of maximum occupancy of spaces outside, or 15% depending on how big the space is. People can go outside up to a limit of 7,500 people. Which does mean that people could go to the Eagles game, but it's got to be pretty sparse, and people are going to have to follow the safety rules.
Well, let's talk about that. For fans that are going to be attending the game, what's your advice to them?
Most important thing is wear a mask, and you're going to have to keep that mask on during the game. And second, you have to be very careful about keeping a distance from other people. There's a lot of space in that big stadium. You're going to have to maintain that no matter how exciting it gets. You're going to be able to sit in your seats, but not move around to the other empty seats. They're going to tie those off. So that you're always a good safe distance from other fans.
And there's sometimes yelling, I've been told, at the game. So I think you should kind of keep it down a little bit.
No, I think yelling is going to be okay as long as you keep your mask on when you're yelling.
Okay, all right. Well, a number of states across the country are reporting an increase in the number of cases. So talk to us about the numbers. Where are we right now in Philadelphia?
Yeah, last week we were nearly 160 cases per day, which is up from about 125 cases per day the week before. Before that, it was fewer than 100 cases per day. So we're definitely on the rise right now. The risk is rising. The greatest risk right now is through small social gatherings. People getting together with their friends and relatives. They've been tired of being alone for a long time. That's very risky. So we have to make sure that people, if you're going to be around your friends and relatives, wear a mask. If you want to get together with people, do it outside.
Are you seeing a particular age group that is seeing more positive cases at this point?
It's generally people from 20 to 50, people in their younger adult years. Again, I think people are just sort of tired of being alone, and so they want to get together for just a group of friends or a wedding or a bridal shower. But those are very dangerous events. The people most likely to give you this infection cruelly are the people that you trust.
So I want to talk about the plan now to send public school students back into the classrooms in Philadelphia. We're hearing that kindergarten through second graders will be the first wave of students to return, possibly on November 30th. Are you confident that that can be done safely?
We do think the schools can do this safely. There are parochial schools and other independent schools in the city that are open. We've been working very closely with them, and although there have been students and staff that have come in with the infection, we don't have any evidence yet of spread within the school building, and so we'll continue to work closely with them. But we're hopeful that if everybody follows the safety rules, that other schools can open safely as well.
Well, speaking of schools, the last question is related to youth sports in the city that you consider high risk, like soccer and football. So kids can practice but still can't play games. In contrast, kids in most surrounding communities have been playing all summer and fall. So what's delaying your decision to allow young athletes in the city to get back into competition?
When you have a competition, there's an awful lot of people hitting into each other. Then when they're out there on the field, they're not wearing masks. Whenever people are getting that close together outside, there's definitely a risk of spread. And then if you put two teams from different towns together, then you're mixing people. Greater opportunity that one person will be negative, another positive, and pass on the infection. So we know sports are important for people, but this is a good time for improving people's skills. And we'll get to the competitions eventually.
Well, Dr. Thomas Farley, we appreciate your input as always. Take care, sir, and we'll be talking to you hopefully in the near future.
All right, thank you.
Attorney